In this video, we're going to talk about terminology. This is the language you'll be using for the rest of the semester. So we're going to look at superficial anatomy, where we're going to look at anatomical landmarks and anatomical regions and anatomical directions. Then we're going to look at sectional anatomy and look at planes and sections of the body and body cavities. We'll start by looking at superficial anatomy. So this is anatomy that you can see from the outside, and we'll look at anatomical landmarks. To begin with, I want to talk about body position. So an anatomical position is when the body is standing with the hands at the side, feet hip width apart, and the hands facing forward, just like you see in this picture. Now, there are a couple of other positions as well that the body can be in, such as the supine position. Supine means that a person is lying down on their back. They're still pretty much in the anatomical position, except for they're lying down on their back and their face is up. Another position is called prone. In the prone position, a person is lying down on their front side. They're still kind of in the anatomical position, but they're just lying down on their front and their face is down. What you're seeing here on these two pictures are anatomical landmarks. These are landmarks that we can see on the outside of the body. And so what you need to do is you need to memorize all of the medical terminology. And when you look at this picture, you're going to see that next to the anatomical terminology, you'll see another term that's in parentheses. The term that's in parentheses is the layman's term. So those are just giving you hints as to what that anatomical terminology means. However, on the exam and for the rest of the class, we'll be using the medical terminology or the anatomical terminology. So you need to memorize all of these. So for instance, let's start looking at the person who is facing forward here, and we'll start from the head and work our way down. So you'll see that these terms also a lot of them end in AL or IC, and this is saying that it's really an adjective and it's not a noun. So frontal means that's an adjective, which means that it's descriptive. So this is the frontal area or the frontal region. So just keep that in mind as well. You might be hearing the noun version of some of these terms, like for instance in the neck area where you see cervical, that is an adjective, so it's the cervical area. The noun would be cervicis. So in your lab list right now, you'll see that there are both the noun and the adjective, and either term that you would use for the lab exam would be fine. You can use the adjective, which is cervical, or you could use the noun, which is cervicis. All right, so that being said, let's look at these adjectives. So the forehead is frontal, the nose is nasal, the eye is ocular, or it could be orbital, though we do use ocular more often. The ear is otic, the cheek is buccal, the neck is cervical. Then the entire head is called cephalic. The skull, if we were just to look at the larger skull bones, that's called cranial. And then if we were look at the face area, the facial features, that's called facial. Then we have the mouth, which is oral, and the chin, which is mental. Then we're going to look at the arms. First of all, the armpit is called axillary. The arm is the humerus or the proximal part of the arm. That's called brachial. Then the front of the elbow is called antecubital, and the forearm is called antebrachial. Then we have the wrist, which is called carpal, the palm, which is called palmar, the fingers are called digits, and the thumb is called pollex. Then we look at the chest. In the chest area, we have the thoracic or thorax area. We have the breast, which is mammary, the abdomen, which is abdominal, and the belly button area or the navel is called umbilical. Lower to the umbilical region is the pelvis, which we call pelvic. Then we have a diagonal area that's the groin area, and that's called inguinal. And we have an area across the pubic bone, which is called pubic. And also, if we were to look at the entire hand, that entire hand is called manual. So the manual or hand has different parts to it, which I had previously said, the carpal, palmar, pollex, and digits. Then let's look at the legs. In the leg area, we have the thigh, and then we have the calf area. So the thigh area is called the femoral area. The kneecap is patellar. The front of the leg, which is the lower leg, so we call the lower leg leg, and we call the upper leg thigh. So on the front of the leg is crural, and on the back of the leg is sural. Then we have the ankle and the foot. The ankle is tarsal. The toes, again, are the same as the fingers. They're called digits. Then we have the great toe, which is called hallux. And the entire foot is called pedal. Now there are some other terminology, some other terms that we see if we look at the back. So on the back, if the person turns around, we can still see the head, which is cephalic, and the neck, which is cervical. But there's another part, if you look at the top of the shoulder, right where the shoulder meets the arm, that's called acromial. The back of the person is called dorsal. The back of the elbow is called olecranon. The low back area is called lumbar, and the layman's term for that is loin. The buttocks area is called the gluteal area. The back of the knee is popliteal. The back of the leg or the calf area is called sural. The heel bone is called calcaneal. And the bottom of the foot, the sole of the foot, is plantar. I think it's important for you to say these terms out loud and then perhaps use index cards or some other method to try to memorize all of these terms. Next, we're going to look at anatomical regions. And the anatomical regions that we're going to focus on are the abdominal pelvic quadrants and regions. So this is an important area because there's a lot of organs in the abdominal pelvic area. Medical professionals like to divide this area up into quadrants, and that way they can locate where a problem might be occurring if a person has pain or other symptoms in one of these areas. So health professionals like to take a look at the abdominal pelvic area and divide it into 4 quadrants by taking an imaginary horizontal line and an imaginary vertical line and dividing it into 4 equal quadrants. So then they name these quadrants as upper and lower quadrants. So there's a right upper quadrant and a left upper quadrant, a right lower quadrant, and a left lower quadrant. So first of all, I'd like you to know that right and left always comes first in any terminology. You would not be talking to someone and tell them that they broke their arm left, right? You would say, you broke your left arm. So it's the same thing with these quadrants. We're not going to say upper quadrant right or upper quadrant left. Right and left always come at the beginning of the term. So the right upper quadrant and the left upper quadrant, the right lower quadrant and the left lower quadrant. In addition to that, in addition to knowing that right and left are the first word in the term, you also need to know that you're looking at the patient's right or left, not your right or left. When you're facing a patient, your right side is going to be on the patient's left side. So always look at the patient and say, is it their right or left side? And then you won't go wrong. So when you're looking at this picture, you'll see that the right upper quadrant is on the same side as that person's right arm, and their left upper quadrant is on the same side as that person's left arm. So let's take a look at this picture down here. And again, we're looking at the blue lines here. The blue lines are dividing this abdominal pelvic area into 4 quadrants with the right and left upper and lower quadrants. And now what we're seeing are all of the organs that fall within those quadrants. So we can tell when a patient is having pain in a certain area, we know what organs are in that quadrant, and we would be able to narrow down what might be causing the problem. So if a person has pain in their right lower quadrant, we might correctly look at the appendix, since the appendix is in the right lower quadrant. If a person is having pain in their left upper quadrant, it might be reasonable to assume that since the stomach is in that area, a patient might be suffering from gastritis. If a person's having pain in their right upper quadrant, we look there and we can see the liver and the gallbladder. Perhaps they're having problems with the liver and the gallbladder. So for this class, you should be able to identify a couple of the organs in each of the quadrants. Now let's take a look at the abdominal pelvic regions. There are 9 abdominal pelvic regions. Now, this is created by invisible lines, imaginary lines, where there's 2 vertical and 2 horizontal imaginary lines, and it divides the abdominal pelvic area up into 9 regions. Then we name these 9 regions. These are not as commonly used by health professionals, but they are pretty commonly used by anatomists. So you need to learn the names and the locations of these regions, but you don't need to learn what organs are in each of these regions. So first of all, let's look at the center of this sort of tic-tac-toe, and we see the umbilical region because that's where the umbilicus is, right? The navel. So that's where we'll start. So that's the umbilical region. Then we'll look at the regions above and below the umbilical region. Above the umbilical region is the epigastric region. So epi means above and gastric means stomach. So epigastric is above the stomach. And then if we look below the umbilical region, we see hypogastric. Hypo means below and gastric means stomach. So hypogastric is below the stomach. So we're sort of saying that the umbilical region is the stomach and epigastric is above it and hypogastric is below it. Now in some terminology, you'll hear the term pubic in place of hypogastric, and that would be acceptable on our lab exam. Then if we look to the right and the left of the umbilical region, we see the lumbar region. Now in the anatomical terminology that we used in the low back area, we said the loin was called lumbar. So we have a right lumbar region and a left lumbar region that's in the area of the loin, and it's right and left of the umbilical region. If we look below the lumbar regions, we'll see the inguinal regions. So the inguinal regions are in the same landmark area as the inguinal landmark that we had mentioned previously. So we have the right inguinal region and the left inguinal region. If you remember again, inguinal means groin. Then the last 2 that we have are on either side of the epigastric region. If you look at that term, it says hypochondriac. Again, hypo means below. Chondriac means cartilage. So what is below? What are those 2 areas below? Well, they're below the rib cage. And the rib cage, all those ribs are connected by cartilage. So there's a lot of cartilage up there in that rib cage area. So hypochondriac means below the cartilage. So we have right hypochondriac region and left hypochondriac region. Next, we want to look at directional terminology. So right and left are two directions that we use when we're looking at anatomical terms, but there are some other directional terms that we need to know also. So let's start by looking at this picture here on the right. And first of all, we'll see that there's a blue arrow showing cranial or cephalic down to caudal. So cranial or cephalic and caudal mean from the head to the tailbone. Any direction moving towards the tailbone is caudal, and anything moving towards the head is cranial or cephalic. So we could say that the ears are cranial to the shoulder, or the ears are cranial to the lumbar region. Then we could say that the lumbar region is caudal to the chin. So these terms are just describing direction. Now also when we're looking at the head down and then from down up to the head, we can use the terms superior and inferior. Superior and inferior are usually used when we're describing going from the head all the way down to the toes. So cranial and caudal are from the head to the tailbone. Superior and inferior are from the head to the toes. So the toes are inferior to the head, and the head is superior to the toes. The hip is inferior to the head, and the head is superior to the hip. Also in this picture are two terms called anterior and posterior. Anterior is the front surface, and posterior is the back surface. So anything moving towards the front is moving in an anterior direction, and anything moving towards the back is in a posterior position. A term that's synonymous with anterior is called ventral. Ventral means the belly side. It's kind of equivalent to the anterior side when referring to the human body. So for example, the umbilicus or the navel is on the anterior or ventral surface of the trunk. Posterior is again the back surface, and a term that's synonymous with posterior is dorsal. Dorsal means the back. It's equivalent to posterior when you're referring to the human body, so you could say posterior or dorsal. The shoulder blade is dorsal or posterior to the rib cage. Now let's take a look at the picture on the left. So on the left we see terms called medial and lateral. Medial is the direction when you're moving towards the midline. If something is closer to the midline, it is medial. Lateral means away from the midline. So anything that's away from the midline of the body would be lateral. So, for example, the shoulder is lateral to the breastbone, and the breastbone is medial to the shoulder. The umbilicus is medial to the hip, but the hip is lateral to the umbilicus. Then we have the terms proximal and distal. So proximal and distal are terms that we use only when we're talking about the limbs, like the arms or the legs. Proximal means closer to the point of attachment of where that limb attaches to the trunk. Distal means away from the point of attachment of that limb to the trunk. So, for example, the shoulder is proximal to the wrist, meaning the shoulder is closer to the body attachment than the wrist is. The fingers are distal to the wrist, meaning the fingers are further away from the attachment point than the wrist is. We can also see this in the legs as well. The hips are proximal to the knee. The ankle is distal to the knee. Other directional terms are superficial and deep. Superficial means close to the body surface. So the skin is superficial to the muscles. Deep means toward the interior of the body and farther away from the surface. So, for example, the bone of the thigh is deep to the surrounding skeletal muscles. Now let's take a look at sectional anatomy, and we're going to start by looking at planes and sections. So there are 3 different planes, and those planes will divide the body up into different sections. So the 3 planes are the transverse plane, the frontal plane, and the sagittal plane. And again, these are imaginary lines in dividing the body into sections. So first let's start and look at a transverse plane. So that's the one down here in the green. The transverse plane divides the body into superior and inferior sections. So basically we're dividing the body into a top and a bottom. And when this cut is made in this transverse plane, it will divide the body into sections, and we'll call those sections a transverse section, a horizontal section, or most commonly, it will be called a cross section. Then we have this frontal plane, and the frontal plane is the purple plane. The frontal plane divides the body into anterior and posterior sections. So basically it's dividing the body into a front and a back. Then we have the sagittal plane. A sagittal plane is this one in blue here, and it divides the body into right and left sections. If that line divided the body into identical right and left portions, then it would be called a mid-sagittal section. It's dividing a mid-sagittal section is when the plane passes right through the midline, separating the body into equal right and left sides. A parasagittal section misses that midline area and it separates the body into right and left sides, but the right and left sides are unequal. These terms are important because in imaging, like in CAT scans and MRIs, they are going to be used to create slices through the body with imaging. Next, we're going to take a look at body cavities. So the body has several different cavities that are very important because each of these cavities contains very important organs and structures that need to be protected. So we have the dorsal body cavity and the ventral body cavity. The dorsal body cavity refers to the fluid-filled space that surrounds the brain and the spinal cord, and it includes the cranial cavity and the spinal cavity. So the brain is in the cranial cavity and the spinal cord is in the spinal cavity. Then we have the ventral body cavity. The ventral body cavity can be divided into 2 cavities. The more superior cavity is called the thoracic cavity, and the lower or inferior cavity is called the abdominopelvic cavity. The muscle called the diaphragm divides the thoracic cavity into the abdominopelvic cavity. Let's take a look at a transverse section through the thoracic cavity so that we can look at the organs, or what we call the viscera, in the thoracic cavity. So when we're looking at this picture, we can see we have the anterior and the posterior side, so the front and the back. But this picture is taken so that you're looking up at the cross section. So it's as if you were laying down at the feet of this cut and looking up toward that person's head. So what we can see here is that there are 3 organs in this cavity. We have the heart, which is in the middle, and then there's 2 lungs. There's a right lung and then there's a left lung. Let's take a look at a drawing here of the thoracic cavity. So first we have the 2 lungs, and then we have a space in between those 2 lungs, and that space is called the mediastinum. The mediastinum is the space that contains the heart and the trachea or windpipe and a gland that's called the thymus. So in this thoracic cavity, when we're looking at the heart and the 2 lungs, each of those organs are in their own cavities within the thoracic cavity. So the heart is going to be in a cavity that we call the pericardial cavity, and each lung will be in a cavity that we call the pleural cavity. Surrounding each of these cavities, the pericardial cavity and the two pleural cavities, is a serous membrane. A serous membrane is a double-layered membrane that contains a fluid in between the two layers called serous fluid. So the serous membrane that surrounds the lung is called the pleura, and the serous membrane that surrounds the heart is called the pericardium. So I said that each of these serous membranes have two layers to them. There's an outer layer that lines the cavity itself, and then there's an inner layer that's adhered closely to the organ, or it covers the organ. The innermost layer is called the visceral layer, and the outermost layer is called the parietal layer. And then in between is a fluid called the serous fluid. These membranes help to reduce friction when these organs are changing size or when there's movement. For example, when the heart is beating, the pericardium helps to prevent friction so that the heart isn't rubbing up against the other structures surrounding it. So if we look at the serous membrane of the lungs, again, we said that the pleura is the name of the serous membrane surrounding the lungs. And so we can talk about the visceral pleura. That is the layer that covers the outer surface of the lung. And we can talk about the parietal pleura, and that's the layer of the serous membrane that covers the mediastinal surface, or the cavity, and the inner body wall. Then when we look at the heart, which is called the pericardial cavity, we can look at the serous membrane there as well. So there's the visceral pericardium. That is the serous membrane layer that's in direct contact with the heart. And there's the parietal pericardium, and that's the serous membrane layer that surrounds the visceral pericardium. So that's the one that surrounds or outlines the pericardial cavity. Then we look at the abdominopelvic cavity. The abdominopelvic cavity extends from the diaphragm to the pelvis. There's a superior abdominal cavity and an inferior pelvic cavity. The abdominal cavity contains a lot of the digestive system organs, and the pelvic cavity contains reproductive system organs. There's no anatomical structure that separates the abdominal cavity from the pelvic cavity. That's why we run those two words together and we call it the abdominal pelvic cavity. The serous membrane associated with the abdominal pelvic cavity, however, does not contain all of the organs from the abdominal cavity and the pelvic cavity inside it. Instead, it contains many of the abdominal cavity organs and some of the pelvic cavity organs. And this new cavity then that contains these organs is called the peritoneal cavity. So the peritoneal cavity is made up of space that surrounds the contents of much of the abdominal pelvic cavity. The name of the serous membrane surrounding the peritoneal cavity is called the peritoneum. The peritoneum also has an inner layer called the visceral layer and an outer layer called the parietal layer. The parietal peritoneum lines the inner surface of the body wall. So it's basically lining the body wall of the abdominal pelvic cavity. The visceral peritoneum covers each of the enclosed organs within the peritoneal cavity. This ends this video on anatomical terminology.